Nearly 80,000 people under the age of 18 live in New Hanover, Brunswick, Pender counties, and when those children need hospital care, they rely on Novant Health, New Hanover Regional Medical Center. Joining us this morning is Dr. Michael Jaskolka, a clinical physician executive for Children's Services. Thanks for being here this morning.
Thanks for having me.
There is a generation of people watching television this morning that if their child was very sick, hopped in the car, maybe went to Chapel Hill, and every single day that kind of changes here along the beach. Tell us about that.
Yeah, I think that, really been an amazing time. I've been in town for about 13 years, and we've just continued to grow the acuity of care that's available and the service offerings that are available at the Children's Hospital.
Do you have to worry about the PR image of that now to remind people that they don't have to travel any further, or they kind of know that now?
I think both, to be frank. I think, as you said, there's been a historic need for many services for people to leave the community. And really, I think our focus, both on the clinical and administrative front at the hospital, is really to continue to drive care closer and local to home for all sorts of specialties, particularly for children.
Let's talk about some of those specialties and some of the options that we now have that we didn't have just a couple of years ago.
Yeah, really fantastic stuff has really been happening since Novant Health has purchased the hospital. One of those things really I'd like to highlight is the partnership with UNC Chapel Hill. One of the focuses has been on bringing additional pediatric subspecialty services. So not only have we really been able to stabilize the offering of things like cardiology and neurology, GI, endocrinology, which we consider core medical services, we've been able to expand into some different subspecialties: nephrology, rheumatology, pediatric urology, and not to mention we still have some core subspecialty services, general, pediatric, and thoracic surgery. And I'm a cleft and craniofacial surgeon, so I have to throw that plug out there as well.
So reputation helps with that recruiting, but you can dangle the beach and sand as well, right?
Yeah, I mean, it's not a bad place, as all of you know, to make your home.
And for kids, what does this mean about options?
I think really, again, there is lots of work to be done, and all of us focus on continuing to move the needle forward. We'd love to see some continued growth in the emergency department, specifically focusing on kids. But for example, we're about to start with our Chapel Hill partners to offer behavioral health offering for children. There's a health and wellness clinic for children. There's a lot of different subspecialty offerings that have kind of grown.
You make it sound like if we were to talk again this time next year, we may have a completely different set of options for folks.
I think it's exciting. Since Novant's purchased the hospital, there's been a huge commitment, and contrary to some of the things that are commonly reported in the news, and thank you for being supportive in that front, there really has been a really growth on an annual basis of services, and I would bet next year we'd be talking about additional 3 or 4 things as well.
Doctor, thank you for being here.
Yeah, thank you for having me.